this is the external surface of the ilium. Okay, now the ilium external surface. First ilium, because we discussed ilium bone, external surface, which formation we have. First, here you can see here, this is iliac crest. This is the iliac crest which I told. This is iliac crest. Iliac crest is the formation. Iliac crest. First iliac crest. Second, which I told, inner surface. Inside we have inner lip, and outside we have outer lip. Okay, outer lip. Okay, next we discuss inner lip inside, and outside we discuss outer lip. Now between inner and outer lip we have this area. This is intermediate zone, or zona intermediata in Latin one. Okay, intermediate zone. Okay, now next formation, we're going to next formation. Here, because this, now here this is the external view. Now this is the interior side, and this is the posterior side, because this is pubic bone and this is the ischium bone. Okay, that is interior side, front side, and posterior. Ischium is posterior side, acetabulum is outside. Now acetabulum, you can see easily, is outside. Now here we have 4 spine. This one spine, 1, 2, 3, and 4. 4 spine we have. This area which I told is in front, this is interior, this is in back, this is posterior. Okay, posterior and interior. This is interior. Now the 4th spine, interior side, we have 2 spine, this one and this one. This one is upper, we can say in terminology is superior. Okay, and in lower we can say in terminology is inferior. Okay, this is superior and this is inferior. Okay, this is superior and this is inferior. Now these spines, now how we will discuss these spines. Spine 2 is the interior side, 2 is posterior side, posterior spine. Now the interior side spine and posterior, how we will know to memorize this spine. First, this is interior side, you can say like this: interior superior iliac spine, interior inferior iliac spine, because the side is interior. Okay, and spine is lower, upper and lower. Interior superior iliac spine and posterior interior superior iliac spine and interior inferior iliac spine. Now here in the back side, posterior, we have posterior, because this is posterior. Now posterior superior iliac spine and posterior inferior iliac spine. Posterior superior and posterior inferior iliac spine. Okay, this is the formation. We're discussing the external surface formation. Okay, this we discussed about the 2 spine interior side and 2 spine posterior side. Now here we have gluteal lines, where the gluteal muscle attachment. First gluteal line. Okay, this is interior. Now the second one, and now is the third one. Okay, this is the gluteal line for muscle attachment. This one, the first gluteal line, this is the second gluteal line, and this is the third gluteal line. Okay, the first gluteal line is the inferior gluteal line, the second one is interior gluteal line, and the back one is in posterior side. This is posterior gluteal line. Again, inferior gluteal line, because this is lower. This is interior gluteal line, and this is posterior gluteal line, because in back side. This whole is the formation about the external surface. First we discuss internal surface. We formation discuss inner lip. Okay, then we discuss iliac fossa, then like ear shape like our fasciculus auricularis, auricular surface. Then we have ischial tuberosity, and there was arcuate lines. They are divided into two parts of the ilium bone: ala, wing part, and body corpus part. Okay, and now is the external surface formation. External surface we have formation iliac crest. This one is iliac crest. Second we have the outer lip, because outer lip in external side and inner lip internal side. Then we have between inner lip and outer lip we have intermediate zona. Now second we have anterior side two formation, and posterior side we have two formation. Anterior side we have anterior superior iliac spine, and posterior interior inferior iliac spine. Posterior side we also have two spines: posterior superior iliac spine and posterior inferior iliac spine. Now we have three gluteal lines for the muscle attachment. The gluteal, because here is the gluteal muscle. This inferior gluteal line, interior gluteal line, and posterior gluteal lines. This is the formation about the ilium bones. One thing more important for you people, you need to memorize this, because from the external surface, from the dorsolateral surface, you need to memorize these all three bones: ilium bones, ischium bone, and pubic bone. These all three bones bodies, like here I told already, there are body parts are divided by triradiate cartilage, because this upper one is for ilium. This is from the dorsolateral surface. This is the body part of ilium bone, and this is the body parts of ischium bone, and this is the body parts of pubic bone. Okay, now we discuss about everything about the ilium parts. Ilium part is the finish. Now we will going to discuss about the pubic bone. Okay, which formation we have in pubic bones. Okay,